So I'm Dr. Mark Wilson. I'm an orthopedic surgeon that did an extra year of training to specialize specifically in sports medicine. So what sports medicine means is we put an emphasis on using a camera to do surgery. So we call that arthroscopic surgery. That doesn't encompass everything that we do in sports medicine, but that is one of the primary focuses of sports medicine. And so with that, there's a lot smaller incisions than having big open incisions for surgery, and a lot of times patients have a faster recovery because of the less soft tissue insult during surgery. Sports medicine is not just taking care of athletes, it's just taking care of an active population of people. Athletes are part of my practice and things that we do, but it's taking care of all types of patients and patients that want to get back to whatever activity level that they normally have. The shoulder joint is one of the joints that we focus on in sports medicine. One of the types of injuries that people can have around the shoulders was called a shoulder dislocation or subluxation. I like to describe the shoulder joint as kind of a golf ball and a golf tee, and so there's a lot of motion that patients can have around the shoulder as compared to other joints. If patients have an injury to the shoulder, the ball can shift out of place or completely pop out of the socket, which would be kind of like the golf ball falling off the golf tee. So there's a wide variety and a wide range of injuries that can happen to the shoulder, and we have a wide variety of treatment options depending on the degree of injury and how long things have been going on. But that is one common one that we see very commonly in sports medicine. In addition to that, people also talk about shoulder separations, which is actually a little different type of an injury, which is actually one of the joints on top of the shoulder where the collarbone meets a hook of bone called the acromion. And that can be from a hard tackle on the shoulder playing football, falling off a bicycle and landing directly on the shoulder. Multiple different ways to have that type of injury, but those we call those AC separations. A lot of people call them separated shoulders in layman's terms. And again, there's a variety of treatment options depending on the degree of injury, whether it be just healing by itself, therapy, and there's definitely a surgical option as well if the degree of injury is significant enough. But those are two sports injuries around the shoulder that we see very commonly, and that we definitely address here at Palmetto Bone and Joint.